Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast. I'm Dan Carter here at Countryside Equine Hospital. Got Dr. Caroline Brown with us.
Good morning.
We changed up our seating today.
We did.
I feel like this is a little bit of Dr. Phil. I feel like we should be diving into a very emotional experience at this point in time.
I mean, today's topic can be quite emotional.
It actually can.
Yes.
It can be quite explosive. All right, well, let's dive into this. We're going to be talking about diarrhea.
Love diarrhea.
Diarrhea.
Everybody's favorite topic.
I know. Nobody really wants to talk about this till it happens.
Mm-hmm.
One of the things I want to stress is diarrhea. If you had to ask me, like colic or colitis, so another word for diarrhea, our big fancy medical word is colitis. If you ask me, do you want colic or colitis, I'm going to take colic every time.
All day.
This is a fatal condition.
Mm-hmm. And there's a lot of different faces to diarrhea. There's like a saying, I think, in human med that one person's diarrhea is another person's normal day. So, some horses live with looser stool,
right.
And that's just they're normal, and they're never going to show any sort of clinical signs of having a bad day in their life. There's other horses that the diarrhea will be fatal, and it's all going to depend on what's going on in their biome and if there is an infectious cause to it and, any other circumstances. There's a lot of things at play here, and there's a lot of different factors, and a lot of times things are multifactorial. We never end up finding what the problem is.
Very, very true. I feel like most of these we treat and never know why they got it. Mm-hmm. Like it's rare we actually get the answer.
Correct, because as we'll come to discuss, a lot of our treatment for these is pretty much the same.
It truly is.
Give or take a few things, but
I mean, I think the bulk of it, we'll get into it later, but just keeping them alive long enough that they can heal.
Yes.
And correct the diarrhea. Mm-hmm. So, all right. So you head out. We get the call. Got a horse, diarrhea. Going to head out. What are some of the things that when you arrive, what's kind of your workup? What are you thinking about? What do we need to go look at?
Mm-hmm. So there's kind of two sections we look at. So we've got, when we're looking at diarrhea, we have our acute diarrhea, which is anything, obviously acute, or chronic diarrhea, which is going to be anything going on longer than a month. And then you have infectious diarrhea causes and then non-infectious diarrhea causes. Pretty self-explanatory in there. And then, but again, a lot of these things are multifactorial. They can have an infectious cause that is going on for months and months and months because they are repeat shudders or because we have some unresolved issues. We can have even stress can induce diarrhea, and right. Stress can allow bacteria to overgrow. Antibiotic use can cause some diarrhea. So, I think the biggest thing when we're looking into our diarrhea is what is our history going into this? What is the age of our horse? What kind of changes have we had? Did we get new feed? Are we on a new property? Did we move around? Were we exposed to anything new recently? Mm-hmm. There's a lot of pictures in here. Is this an older horse or a younger horse?
A lot of questions like that's, you brought it up. Like, it's interesting how important that history is, because if you tell me it's spring of the year and you planted ryegrass and your stool's a little soft and loose, I'm not as concerned.
Not as worried.
But, other times it's like, no, everything's been the same and this just started and we can't, like, it's just spraying everywhere.
Right.
That's a bigger deal. So history. So, when we show up and we're playing 20 questions, like, try to give us as much information. Try to give your vet as much information you can as what's been going on, and help us work through that.
Right.
So,
right.
When we arrive, one of the things we're going to do is take a temperature. That's a very important thing.
Yes.
That's going to clue us in infectious, non-infectious. Try not to. I guess we're looking at that, and we're looking at blood work, things like that, to help us sort of rule out where we're going with this.
and what even we need to do for it too. And
Yep.
so probably one of the biggest things that we worry about when we have these cases, whether it's acute diarrhea, whether it's chronic diarrhea, is dehydration.
Yes.
So when the horse is expelling all of this excess fluid through their digestive tract, we're losing all of that fluid from our circulation, and that's causing dehydration. And so that's one of our biggest concerns with managing these horses and treating these horses is keeping their hydration up. Now, these horses that are maybe having some low-grade diarrhea, it's not super frequent, their stool is just, a looser texture than what it's been. If they're keeping themselves adequately hydrated on their own, we may not need to jump to saying, hey, let's, tube this horse, let's give them some extra electrolytes, let's give them some IV fluids. But these horses that are just having, explosive episodes of diarrhea and it's super frequent, we're going to want to help these guys out with some IV fluids.
Well, and that's one of the things that's really important is because when we're looking at these causes, something can start off as just a dysbiosis, which is where the microbial population gets altered in the gut. That can be secondary from a feed change or new grass that's coming in the spring. But sometimes, because a lot of these infectious agents we're going to talk about are normal inhabitants of the GI tract, but when they get an opportunistic situation, you can have a non-infectious diarrhea turn into an infectious. And one of the things we know is hydration helps prevent that from happening. It's probably our best preventative we have. It's not super great, but it's one of the best ones we have of preventing something small from turning into something big.
Right. I think a really good example of that, just kind of transitioning into that, is Salmonella.
Perfect.
Salmonella is one of those things that it's around in the microbiome. It's there, but it's a really small player. But when you start, stressing out that microbiome by, changing your feed or putting a horse on antibiotics, even if it's a responsible use of antibiotics, such as, we're treating a cellulitis or something, it's that change in there that causes the Salmonella to overgrow and become a problem. And Salmonella is a huge issue. And this is one, too, that is zoonotic. So if we're talking about Salmonella, and we diagnose your horse with it, which is, we have to do that usually through a fecal PCR. We have to have multiple samples of this in order to do that. That's something we want to be super, super careful about biosecurity-wise, because you can catch this, your other horses can catch this as well. And in the state of Georgia, this is actually a reportable disease.
It is.
It was always interesting when I worked in South Carolina, because Salmonella is not reportable there, but we'd send our test to Georgia and they'd come back and they're like, this is reportable, and we're like, not here, not where we are. But
and that's the thing, is it really varies state to state which one of these conditions is reportable and which one's not. But no, and that's, you bring up a good topic there. A lot of times when we're going out seeing horses, people are like, why aren't you just giving me an antibiotic? Why can't you just have an antibiotic? Or why can't we just change an antibiotic? Why are we not? Well, in the back of our minds, this is always there. When we start a horse on antibiotics, we know there's always a risk of, if they're a carrier of Salmonella, is this going to have a side effect to where, and basically the way it works is these antibiotics kill off the good bacteria, allow the Salmonella to grow in the colon, and produce this diarrhea. So this is something we have to think about every time we give an antibiotic.
correct.
It is always in the back of our mind, like, okay, is this the right situation? Do I really need it? And is this the best use? Because I do have this risk of Salmonella. So that's one of the things that goes through. And you're right, Salmonella, it's, you usually have these persistent carriers of it that are always sort of shedding a low-grade amount of Salmonella. They can spread it among other horses. And then different factors can bring out the Salmonella. We talked about antibiotic use, stress. Just bringing a new herd mate is enough to cause enough stress to make a horse break with Salmonella.
Right. And you can get these big outbreaks with Salmonella too. I feel like when we would see them, we'd see them in waves, and it's, again, usually because somebody traveled somewhere and the horse came back, or they changed the feed up, and now all these horses are just getting sick. And even if it just started with one, it can go through, and Salmonella can turn into sepsis very quickly,
Very quickly.
Especially in our foals. That's where you see some really sick little foals and joint flares and all the things. So
now, salmonella and the LPS it produces it's real.
It is real.
It is real.
It's a concern.
So I think it's important when these things start. This is why one of the first things you'll hear us say is like, okay, how can we isolate this horse? Like, if we're on the farm with the diarrhea, we're always like, how do we keep this horse separated? Even if it's not infectious, it's always on our mind.
Right.
Because what if it is infectious? Especially waiting for tests to come back. And like I said, with salmonella, it's multiple PCRs. It's not a one and done. 3 negative PCRs, I think, before you can say it's not salmonella.
Correct. Yeah, you have to have 3.
It's very important to keep these horses separated.
They'll do it as a biosecurity too at a lot of, I know at Florida we would immediately send off 3 different fecal samples right when the horse got there, just to know, because again, you're bringing these horses into a new environment when they're staying in a hospital, whether it's they're there for surgery or for, illness or, whatever they're there for. And you're changing their food, you're changing their environment, and they're screening to make sure that these guys aren't breaking with a salmonella.
We do the same thing in Kentucky. Our colics, whether they were surgical, non-surgical, medicine cases, things like that, would get screened for salmonella. And then once that horse was positive for salmonella, it went into the record. And when that horse came in, we knew this was a possibility.
Right.
Because once they have salmonella in the GI tract, they never really get rid of it.
No.
So it's kind of like, all right, I got a salmonella horse. I need to be cautious.
Right.
So, other infectious causes are the dreaded old Clostridium as well.
Oh, Clostridium, yes.
So
I learned in my research that the reason it's called Clostridium difficile is because it's difficult to culture. I was like, I don't know if that's true, but I'm like, it made me laugh.
It makes you think even nerds have fun,
Exactly. I was like,
difficile. It's difficult to treat.
I was like, I don't know if that's accurate or not, but I like it. I was like, this is interesting.
Yes.
But I think the reason this one becomes difficult is, again, this one is found in the microbiome of horses, and this one's an anaerobic bacteria.
Yes.
So when we talk about bacteria, just going into some very biology 101 for you, you have your aerobic bacteria, and these ones require oxygen in order to live and to reproduce, and then you have your anaerobic bacteria that do not require oxygen. You can see the problem in that the easy way to start treating some of these aerobics is just starve them out a little bit. You can get rid of them. The anaerobes, they're a little bit hardier.
They're hardy.
They're hardy. We don't always have as many antibiotic options to treat our anaerobes either. So
and the hard part about Clostridium too is it produces this exotoxin, right?
Yes.
So this exotoxin actually helps kill cells to produce a better place for it to live.
Yes. So
it's, that's a big thing. Like salmonella, when it dies, it releases LPS, and it's almost gram-negative, if I remember correctly. Gram-negative releasing that LPS, and it can cause toxicity. But the Clostridium species is in there, like, cranking out this exotoxin. Like, how do I create a better environment for me to thrive? I mean, I'm gonna kill my host.
Yes.
However, I'm going to live. And so...
And these things are hardy, too.
Yes, spore forming. I mean, these things are ridiculous.
Yes. And these horses that get Clostridium, they got some bloody diarrhea.
Yes.
It is, they are, like, nuking this horse from the inside. I don't know if I can say nuke on the podcast, but, like...
I think so.
Okay.
It's our podcast.
Casey, you can cut that out if you need to.
But so Clostridium, you're talking about your perfringens, you're talking about your difficiles, and there's a lot of other species in there that don't cause diarrhea. Like the Clostridium family is where Clostridium tetani lives.
Yes.
Clostridium botulinum, so that's tetanus and botulism. Those typically, we typically don't worry about those as much in the diarrhea situation, but the difficile and the perfringens are 2 big ones that we worry about there.
Yes, and these can be quite infectious. These can spread through your herd. This is actually one where you see this you see C. diff specifically in mares whose foals are receiving antibiotics.
Yes.
For foals that are getting treated for rotacoccus, you'll see their mares break with this because of the antibiotics that are being
and
shed.
it's nothing to play around with. I mean,
No.
24 hours makes a huge difference in the C. diff case.
100%.
So it's and the other thing is, like we talked about before, you get these infectious causes. It may start out as a non-infectious cause and then turn into one of these infectious causes.
Because you've stressed out your microbiome
Right.
and allowed something to grow. The gut microbiome is such a cool thing. Like
Yes.
there's so much research that's coming out about the microbiome and the differences in microbiome just between individuals and between different populations of animals. It's really cool, and there's so many little things, and I think that's one of the things I'm excited about, just watching research come through, is learning more about this and how to create a good microbiome.
Well, and it's interesting because if you look at antibiotics, because we know horses can get an antibiotic-induced colitis. And if you look at regions of the country, they have certain antibiotics that are more likely to do that.
Yes.
Like, we can use Baytril down here, and we think nothing about it. You talk to somebody in California, and they're about half terrified of Baytril because it induces these, it makes these horses more prone to an antibiotic-induced colitis.
Really? I didn't know
Yes.
that.
Like, I've talked to friends of mine that practice in California, and they're like, man, Baytril? No, we don't touch it. And I've been in other places where ceftriaxone
Yeah, I have. Yeah.
is prone to do that. So, and that has to do with the population of bacteria that these horses are exposed to. And like I was a ruminant nutritionist before I was a farrier, and so we talk a lot about microbiomes in cattle.
Oh yeah.
And ruminants, and we've been doing that for years. It seems like just in the past 10 to 15 years, we've really started to look into these microbiomes in horses as well, because it's a little more difficult to do, but we do know that these microbiomes in that colon and cecum, they're critical.
Right.
So.
And that's I think a good time to talk about probiotics and prebiotics and all of that. I think that's it's one of those things, if you take antibiotics for yourself, they're like, well, should I start taking some probiotics? And not all probiotics are created equal.
They're not, and the research on effectiveness of probiotics is
It's questionable.
It's
questionable.
That's the
at
word
best.
I'm looking for. Questionable. We're not sure if this actually works or not.
No.
So
There's nothing to say that it's harmful, but there's nothing definitive to say that it helps either.
Right.
So, I always have people, if I put their horse on antibiotics, say for, an infection, and they're asking, well, do I get them some probiotics? I said, it's not going to hurt to put them on it, but I would rather you just try to keep the gut healthy. So don't make any major feeding changes to them. Make sure we're getting a good quality hay, lots of fiber, lots of just good energy for our horse, and trying to keep everything else as routine as possible.
Right.
Because the best way to heal the gut is to feed the gut.
I was going to say, it seems like there's like two camps, and I feel like I'm in the middle. Some people say feed them through the colitis. Some people say don't feed them through the colitis. I'm kind of somewhere in the middle. There's a point where we need to maybe hold them off, but then we know that one of the we'll talk later about biosponge and bioclay. Well, the best biosponge in the world is hay.
Fiber.
Yeah, fiber is the best biosponge we've got, and so a lot of times I'm trying to feed them through, and we're kind of jumping ahead there, but no, you're 100% right.
Yeah. Now, I mean, you're still going to catch me drinking my kefir anytime I have to go on antibiotics, but that's just because I like kefir. But
I am not a kefir.
Not a fan?
No, that or yogurt.
You don't like that tang?
I don't like the yogurt, but I drink buttermilk. Like, that's the weird part.
Really?
I love buttermilk.
Ugh.
But yogurt,
Oh.
no yogurt.
Oh, I like the little tang. I'm like, give me all of that. Give me all those live cultures.
No. Let's talk about another one another infectious cause that this is not we're gonna use a word that used to I could throw out there with no problem, but now I feel like I've got to be careful. But coronavirus.
Ha!
And
this,
this is
this video is gonna get flagged.
yeah. This is not the coronavirus that we've spent the last 4 years dealing with.
Correct.
It is in that family, but this is not the same coronavirus that people get.
Right.
This is a coronavirus that is specific to horses.
Yes.
And this one's always interesting because coronavirus, you can have 5 negative PCRs, and it might still be coronavirus.
Right.
It's one that it seems to come in waves. Like when we get one, we're fixing to see 10.
Yes.
And then it may not even be on the same farm.
No.
And they won't even travel in the same circles. But for whatever reason, this thing raises its head. They get diarrhea. They will spike a temp. Some of them are pretty mild. Like I've had some that get the explosive diarrhea for 24, 48 hours. Temp goes up, and then it's like as quick as it came on, it's like, I'm good.
Mm-hmm. I mean, and these temps get high, too.
Yes.
I've seen some like 105, 106. I mean, very high temperature.
They skyrocket.
Yes. And they'll get diarrhea. A lot of them are just kind of more colicky, like I just don't feel good episodes. But there's no respiratory signs.
No respiratory
signs.
This is pure GI coronavirus.
Yes. So it's...
And I want to repeat, you're not going to get coronavirus from your horse.
No.
This is not zoonotic. You're not going to get it.
No.
This is just horse to horse. And what's interesting is you can have horses sharing pastures. One horse breaks with it, and then the other 5 don't. There's no rhyme or reason to which one really breaks with it.
They say this is kind of a winter disease. Like we see this in the winter a lot.
I'd agree.
I swear I saw like 3 this year already.
Oh, wow.
And it was, I mean, again, never got a confirmation on it because we never tested it. But I'm like, I don't know what else it was.
Yeah, usually if I get explosive diarrhea and it's really high temps, that's probably coronavirus.
Yeah, I'm like, it was all suspicion, but I was like, I don't know what else it could be because there wasn't any other, relevant history leading up to it, and they never really needed much other than some supportive care. But none of those happened in the winter. They were all spring and summer. But
I do typically see them late fall and winter.
Yeah,
that's when I typically see them.
But
again, it's like one of them raises their head, and one of the things we do is somebody comes back and say, "Hey, I got a suspect corona. Y'all be on the lookout."
Yep.
And sure enough, we're going to see 10 of them.
And then they just pop up everywhere.
Yep.
Yeah.
And then goes away. As fast as it got here, it just goes away.
Yep.
But yeah, that's one. Again, we're going to talk about supportive care. It's how we get those horses through. It's a virus. Antivirals really aren't going to do anything. It's supportive care, trying to prevent one of these other secondary bacterial infections, and horses typically recover and do really well.
Yeah, never look back.
And, what's other interesting about that one too is very few of those horses have I had to put on IV fluids. For whatever reason, most of them drink enough to keep themselves hydrated. And the majority of them, if I can keep that fever down, they continue to eat through it, and 24 to 48 hours later,
they're good to go.
We're good to go. It's like nothing ever happened.
Again, it's a fast onset, but it's a fast recovery,
right.
Assuming you don't get any other secondary things in there. But
the only ones I've had be long term have been if they get a secondary Salmonella or a secondary Clostridium, those are the only ones that I feel like have a more long term battle. But straight coronavirus, it comes and goes, and like some of them, by the time we get there, it's already cleared up.
Right, yeah.
Like they'll notice some diarrhea that night, and they're like, they don't really think anything about it. Or a horse just didn't want to eat that night, just didn't seem right, and they call us the next morning, but he's like, he's still not good. And then we get there, and temp's down.
Horse is fine.
Horse is fine.
Horse is fine.
So
manure's already hardening up. I'm like, all right.
Yeah, it's interesting.
Send you on your way. Here's some bioclay.
Yep. So another one that's infectious that thankfully we don't really see much down here in Georgia is Potomac horse fever.
Oh, Potomac. I saw a lot of those growing up.
Oh, I bet.
Oh, I saw a ton of them.
When I was in Kentucky, we saw a bunch.
Oh, it's awful.
It originated on the Potomac River up in Virginia.
Yes.
And it's kind of it's a bacterium, and it's harbored in flukes and snails.
Yes.
And they have to eat the fluke or the snail to get this.
Right.
Well, I take that back. Not just flukes and snails, some insects.
There's like mayflies. I saw some dragonflies can do it too. But yeah, the horse has to ingest this fluke that's often inside of a snail or a fly. And then they just get this disgusting, they call it pipe stream diarrhea.
Yes.
There's like this picture that I swear is on like every single like PowerPoint lecture I've ever seen about this, that it's like just this like perfect like arc of diarrhea coming out of the horse's butt, and I'm like, I swear that's like every single picture that they show
like
for this.
Somebody got
like,
that one picture and shared it with all their professors.
And
like,
everywhere.
This is the one. I think it's a bay horse.
Yes.
It's this bay horse, and it's like arched up, and it is truly every slide I've ever seen at every lecture.
I'm gonna find it. I'm gonna put it on for the tag of this podcast, because it's literally like every single time that you read about this, it's like, here's this picture.
I mean, after a while, you're convinced like one horse ever got this.
Yeah,
you know,
you're like, okay, yeah, that's it, and for having seen it, that's exactly what it looks like. It's just, it's there.
Yep.
These guys are sicky poos, though. They are sick horses when they get this.
And
high fevers,
ridiculously high fevers.
Yes, they are so dehydrated. These guys are usually going on fluids.
When it's like by the time you see it, they're already way past sick.
Yeah.
I mean, it is, and the biggest thing that occurs from this is the secondary laminitis.
Yes.
As a podiatrist, I can tell you the worst laminitis I have ever seen. Like, you hear stories about horses walking out of their feet. We're like, oh, he walked out of his feet, meaning like his feet just fell off. And everybody's like, oh, that doesn't happen. No. I have literally watched it happen with Potomac horses.
Yeah.
Like, they get this laminitis that is just
and it's all 4 feet.
Yes.
It's usually the back feet when I've seen it. It's
back
like the
feet.
back feet go first and then the front feet. I don't know why, but
that is exactly what they do. Back feet first.
Uh-huh.
And then the front feet. And I'm going to go ahead and tell you, I hate admitting this, but when they get laminitis from Potomac, very seldom, if ever, do we fix this. I have not been a part of one that got better yet.
No.
It is hard.
Even the ones that, when we hospitalized them at the places that I worked at, even if they weren't having laminitis signs, they were all in ice boots.
Right.
They were all in ice boots just to try to prevent it from getting to that point.
Because that's usually the deal killer there.
Yeah. If they get that, like, your prognosis just tanks.
Right.
After that.
The good news, it is somewhat treatable.
Yes.
Oxytetracycline does a fantastic job with it. It's just a matter of how sick were they before we started this Oxytet.
And just trying to catch up and keep them, just keep them as hydrated as you can. That laminitis care is super important. Yeah, but.
And in places that it's endemic, and like I said, it started just in that Potomac River Valley, and it is continuing to spread. Like it is, and it's spreading quite rapidly. And there's been some discussion even here in Georgia on the Etowah River Valley of Potomac. So
yeah, I remember a couple years ago we had a couple cases pop up sporadically, and it screamed Potomac, but we could never get it to test on a PCR. But I'm like, if there's different strains of it, and we're not testing for those strains here, what it could be. But
I had one a few years ago, and it was interesting. I saw it on emergency, and what I saw it for was laminitis in the hind feet.
Yes, yeah, it was.
And so I see this horse with laminitis in the hind feet, and I was like, well, that's odd. But it was also a gaited horse, so they kind of do weird things. And so I was treating that, and then 24, and no fevers, everything was good. And about 24 hours later, we broke with a fever, pipe stream diarrhea, and I was like, if I was in Kentucky, this would be Potomac.
Yes.
And we actually treated it like a Potomac case. We got the Potomac fixed, but we lost the back feet.
Right.
Which makes me, and again, we tried, I think I had 3 different PCRs, never got it to PCR.
Never got it to test. Yep. I remember this case.
Yep.
Because I think I went out after you, and I was like, do you know this horse had a fever? And you're like, no.
Yeah, that's because I was on call that weekend.
Yeah.
I saw the horse, and I was just dealing with laminitis, no fevers. And then you went out, I think, on like Monday or Tuesday.
It was like some 105
right.
fever, like something crazy. And I was like, whoa, this is This just got way more complex.
Yeah, this just got real Western.
Yeah,
up in here.
this real Midwestern.
Yes.
Yes.
And there is a vaccine for it. And it's what we call a risk-based vaccine. Like down here, we don't really utilize it. But it's like every other vaccine for bacterium. It's not the greatest, but there is some thought that it can reduce clinical signs if they are vaccinated. So in endemic areas, like you talk to people up in Virginia, and even in endemic areas in Kentucky, they utilize this vaccine. We haven't really added it to our protocol down here. We don't typically see it.
No.
There's been some discussion, people, if you've got horses on the banks of the Etowah River, that you need to have a discussion with your vet. Because like I said, it's interesting because it's the mayflies that are produced on the river get attracted to lights, and those mayflies end up going to the barns that are close by, and then when they die, they fall into the hay and they consume the mayfly, and that's where they get it.
Interesting. Okay.
So that's the current thought process.
Okay.
I'm a big fly fisherman, so when I go fly fishing, I always say like, I'm out here doing Potomac survey. Because trout love to eat mayflies. So.
Oh, I love that.
Doing a little mayfly survey. So yeah, Potomac. Thankfully in Georgia we don't deal with it, but for all our veterinarians that are in endemic areas, Godspeed. I hate Potomac.
It's not fun. I mean, it's just once you've seen one too. Once you smell that one too, that one's.
Oh
yeah.
It's bad.
If you know, you know.
Yeah. So another infectious cause, again, we don't see a ton of it here, Lawsonia.
Lawsonia.
Lawsonia intracellularis.
I feel like I forget about this one because, again, we just don't see it here. But this it's another infectious cause. And this one actually, it's interesting because the bacteria directly infects the intestinal cell walls.
Right.
And this one causes this, like, just hypertrophy of these cell walls. So these cell walls get thick.
And it targets that
extremely
ileum.
Thick. Yes.
Like even a specific part of the small intestine.
Yes.
It likes the ileum. Like how did it pick the ileum and be like, hey.
Which is like the shortest part of the intestine too.
You're my house.
Yes. And these really thick cell walls, they have terrible, terrible brush border, so they can't absorb anything at all.
No.
So they get this very wet diarrhea, but they also, one of the big complaints you see with this is they can't absorb any protein. And so they get all this ventral edema.
And massive weight loss.
Yes. And this is mostly affecting like weanling foals are kind of our target audience here. So you just get these foals that just look awful.
Right.
And a lot of them too, they're not necessarily super sick at first, but even if they have like a low grade version of it. And so a lot of people, I feel like, will just blame it on worms. And you're like, no, these guys, they got some funk.
Because a lot of times their stool, it can go from like pipe stream to just being a little bit loose.
Yeah.
And ill thrift foals, ill thrift yearlings, they just failure to thrive, not gaining. This is one of the things we look at is Lawsonia.
Yeah.
So it's like I said, thankfully we don't see a ton of it here.
No, we don't.
Our brethren that do, it seems to be in like larger breeding populations. So Kentucky area, Texas, even up in New York, Pennsylvania, they tend to see a lot more of this.
It's like a racetrack disease.
It kind of is, yeah.
Or like training track disease. Yeah. That's what I was always taught at that one.
So yeah, Lawsonia, you don't want to deal with that.
No, I've seen a couple of them, and I'm like, ugh, they just look.
So
yeah, they just look terrible. It's like because you look at that foal and then you look at the other foals and you're like, something doesn't add up. Like
right, you look at a herd, you get like 10 or 15 foals out there, and like one of those is half the size of the others.
Yeah.
You're like, hey, we need to go look for some Lawsonia here. And again, they typically blame it on parasites.
Yeah, they're always like, oh, well, he's just super wormy. I'm like,
is he? Well, speaking of parasites, let's talk about parasitic causes of colitis.
You got a lot of them in there. There are so many.
I know one of the ones I think about a lot, and it's always kind of interesting, is it's one of the few times these small strongyles cause an issue in adult horses when you get that synchronous immersion. where, depending on where you're at, like small strongyles or cyathostones will actually go dormant. And they have these L3 larvae that hang out in the colon wall, and for whatever reason, the temperature and the conditions hit right outside. How it knows, I do not know. But they're like, you know what, guys? Now's our time. Let's all leave the colon, go become adults, and lay eggs. And when those things just take off out of the colon, you can get some pretty good diarrhea with that.
It is, yeah. These guys are very sick too, because they'll just tear up their intestinal wall. They will just tear it up on their way out.
Yep. And it's a hard one to prove because, again, all we can do is go look for the eggs.
Right.
And it's kind of a diagnosis by exclusion, I guess you'd say.
Yeah.
So time of year matters, deworming history, things like that. But yeah, that synchronous immersion of small strongyles will definitely cause the diarrhea.
Luckily, we don't see crypto and things. And,
thank God, yeah.
There's a couple cases of like equine cryptosporidium, but it's not nearly as big of a problem as you see in like dairy cattle and all the things, thank God.
Yeah, we got enough to deal with. We don't need crypto.
No. If you're a vet student, enjoy your crypto.
Yes.
Yeah.
If you do dairy practice, you're going to get crypto.
Yeah, at some point. And there's different strains of crypto, too. Because I've had both Midwest crypto and Florida crypto. And they're two different kinds. I thought I was in the clear after I got it in Wisconsin. I was not.
Well, you should be good now.
I hope so.
Just avoid crypto.
Just avoid baby cows in general.
Yes, baby cows and crypto. The other ones are some of the foals with the ascarids.
Yes.
They can. That's why it's important. We've done an episode before on deworming, and I try to tell people, like, talk to your veterinarian about a plan, because you don't deworm foals like you deworm adult horses.
No.
Because we're trying to prevent an entirely different parasite, and we're trying to prevent this diarrhea secondary to parasites.
Right.
And that's one of the things too, that other than a synchronous immersion of parasites, if your horse gets any kind of parasite control and it's an adult, it's probably not worms causing diarrhea.
No.
Now, foals, it's almost like parasites still proving otherwise.
Pretty much.
I mean, we're going to deworm them. That's just part of our treatment.
They'll come out the front end and the back end.
You see, you've seen that too, where you get them in the tube?
Yeah, that was a traumatic experience, just coming out the tube.
Yep. Did not enjoy that
at
all.
That right about there, I was like, do I really want to be doing this?
And it's truly a gut check moment.
It was moving. It was NASCAR, and it was just going. It was just swimming in my reflux bucket. I'm like,
nope.
Yep, there we go. Like this is a horror movie now.
Yeah. So parasites can cause it, but really and truly in today's age, it's far less common. If you've seen an anthelmintic, if you've seen a dewormer, your horse has seen one, the risk of it being parasites is pretty low.
But again, people love to blame the parasites when it comes to these. So that's, when we go and we, are working up these diarrhea cases, I feel like the one thing that always comes up is they're like, well, I dewormed him and we did this. I'm like, all right. I'm like, I know. I still like to take a fecal sample and test for a fecal egg count, because, you get these with deworming and all things we've talked about. Yes, you still get some some anti-helmintic resistance with things. So it's always, good to rule that out. But there's so many other causes to chronic diarrhea, and parasites are a really easy scapegoat because they're everywhere. But I think if we can get one thing from this podcast, is that it's like, parasites are not really our key player when it comes to this.
They're very low on my list of rule outs when I show up.
Unless you're in a really poor management standpoint, and if you don't really have a clear history on this horse, maybe you picked it up from an auction or something, and it's just kind of ill-thrifty in general, sure, we can go down the parasite route. But in a horse that's had otherwise like pretty good management and things, we got to start looking into other things. So
yeah, parasites pretty low.
Yeah. Speaking of that, let's talk about sand.
Sand, yes. This is like, let's talk about sand.
I love sand.
Yep.
Sand colic, fortunately, it's not something we see a lot of here.
No, we have mostly clay soil here.
Yeah. The population I'd say I see it the most in are miniature horses on a dry lot.
Yep.
They tend to be our are kind of poster child for that here. And so, and people are like, oh, well, if I'm not on a beach, I'm good. And sand just kind of means any sort of loose dirt.
Right, just dirt.
Just dirt in general. We call it sand because it looks like sand, and it actually feels like sand when you rectal them. You can actually, sometimes these ones that are super, sand,
you feel the
sand
grit.
bound, you could feel the grit when you're rectaling them. It's crazy. But this sand just accumulates at the bottom of their colon, and it will tear their gut up.
Yes.
It will cause such an inflammatory response. I've actually seen them they were like shedding pieces of their mucosa. It was so awful. And there's a couple fun ways we diagnose this. The kind of easiest one to do is our fecal sand test. So,
I love that test.
Oh, it's great. So you just take grab a little handful of manure, usually right off our rectal exam, put it in our rectal sleeve, fill it up with some water, let it sit for about 5 minutes, and then you watch all of the sand sediment into the fingers of the glove. And luckily here we don't get a ton of it. You'll see like little kind of trace pieces of sand. The ones that I did when I was in Florida, I mean, you see the entire fingers
I was going to
fill
say,
up.
when I was in Arizona, like the entire finger would fill up.
Yes.
I mean, it was just amazing how much sand.
Crazy. And that's just the stuff that they're passing. That doesn't even account for the sand that's sitting in the bottom of their colon.
And like sometimes you'll literally shoot an x-ray. If you've got a big enough machine, you can x-ray and get the bottom of that colon, and it will literally look like the entire lower colon. You can see the sand in there.
A line of sand.
Like inches thick.
Yes.
So.
And it is, these guys can be really poor doers. They can look like a lot of different things. The ones we see that are really, really sick, obviously they're going through an event and they'll have some diarrhea, but, and then we got to try to clear that sand out. But these guys can just look very, unthrifty. If it's in a chronic case, they'll be just poor weight loss. They'll have really poor quality manure. A lot of them just kind of present with these, repeat kind of, mildly colicky episodes, and the theory is that it's that sand just kind of moving around and really stretching out that mucosa. But this can be a huge problem for all of our colleagues on the coast. I'm sorry.
Well, and one of the things is, I always say prevention. Prevention's always worth. What they say, an ounce of prevention is worth a pound of cure. Where I see this the most is people that are feeding outside with the buckets on the fence, and horses are always dropping grain, and then the horses, there's dirt underneath there. Well, they're down there eating that grain, and they're picking up that dirt while they're there. And one of the easiest things to do is put a couple mats down, and let's prevent this, because like I said, once you get it and all that sand's in there, we've got to get all that sand out.
Yeah,
and that is not an easy process.
No. So this is where psyllium comes in. Psyllium is your friend. They have a lot of commercial products it's called Sand Clear is probably the most common one, and it's just really hyper concentrated pelleted psyllium. And the theory is that you give it to them, for every day for a week, once a month, and that's kind of to clear the sand out. I know there's some people, they just feed their horses straight psyllium every day because their horses are so chronic with it. When we would actively treat horses with this, I'd be tubing them with psyllium.
Right.
I'd just get big buckets of Metamucil and just be straight tubing it to them just to try to get all of that to move out of them.
Well, and you get in these endemic areas, like places like out in Arizona or down in Florida where sand is everywhere. It's like part of these horses' diets.
Yes.
If they're outside, they're
on Sand Clear.
They're on Sand Clear.
Yep.
That's what we're going to do. But there was actually an interesting study. A guy was, I wish I could find it. He was blotting the abdomen, basically taking his knee and not doing like a belly kick, but kind of just jiggling the belly with a knee. And he was measuring how much sand.
Ooh.
And he was actually clearing a lot of sand out of there.
But just
it was like just kind
of
bouncing it. So now I'm going to say that don't go out there and start belly kicking your horse.
Please don't do that.
And trying to get this out. But he was like bouncing it up out of the colon and seeing if it passed through. And I was just thinking, well, poor grad student was out there having to do this, or vet student, just like taking their knee and like doing these belly lifts.
Horses please leave me alone.
Yeah. And he was like measuring how much sand he got out that way.
They say too, when you listen to their gut sounds, that you can hear the sand moving through their gut. Like it sounds like ocean waves. I've never been able to hear that.
No, I
even in
haven't
some
either.
like very sandy horses, I've never been able to hear.
I mean, I'm calling faults on this one.
Yeah, I'm like, if you're one of these vets out here that says you can hear that, I'm like, I don't know about that.
Yeah, I mean, I've spent a lot of time on the ocean, and I've yet to hear these ocean waves in that colon.
In the gut, but
Yeah, so again, I call that myth. So I haven't heard that ocean wave.
No,
So,
doesn't exist.
but yeah. So that's a lot of our causes. One we did not. Well, two more we need to talk about. One of them we're going to talk about really briefly, and that's IBD.
Yeah.
We're going to do a whole nother episode on IBD. We're going to get that one out pretty quick. It's inflammatory bowel disease. It's actually an immune-mediated cause of diarrhea. And this is one that sees us way more than we see it.
Right.
Like it kind of sneaks up on you. They kind of have these intermittent bouts of diarrhea. They're kind of like ill thrift. They're not doing well. And like I said, there's 5 different kinds. And depending on which one you've got is how serious it is.
Yeah, it's either bad or really bad.
Right. So.
Some of them are manageable. Mm-hmm. Some of them are not.
Right. And the other one we're going to talk about just briefly is right dorsal colitis.
Yes.
This happens when we're throwing bute at horses.
Yeah.
Bute seems to be a cause that, for whatever reason, it irritates a particular part of the colon that produces these ulcers, and they get a colitis secondary to it. This is, I'm just going to go there. This is where the whole thing about hindgut ulcers came from. I swore I wasn't going to go there. One paper out of LSU and set off a multi-million-dollar industry on hindgut ulcers, and he was describing right dorsal colitis secondary to NSAID administration. So, Casey, you can delete that out if you want. I'm going to hold on. So, but all right. So let's talk about. I know this is just like a big overview. We're going to do some deep dives into this. It's kind of a brief overview, so your horse has diarrhea. What are your key takeaways?
You know, my thing, if we can get one thing out of this, is that not all diarrhea is created equal. Some of it's going to be, you know, pretty subclinical or even just self-limiting, that it's going to get better on its own. A lot of it's not. So knowing your horse's history, you know, did we have any exposure to things? Do we have any big feed changes? What's our deworming schedule like? That's going to be really important with this. And then, you know, with most of these, supportive care is going to be the most important. A lot of that is things that you can do, you know, on your own. So making sure we're keeping them hydrated. We love some sweet tea here.
Yes.
You know, making sure that we've got good quality like hay that we're continuing to feed them. You know, with a lot of these, like we said, feeding the gut is the best way to heal the gut. And then, you know, being in touch with your vet and keeping us in the loop, because for some of these causes, if they are getting super sick, we do need to take some intervention. So IV fluids, NSAIDs where it's appropriate to control fevers, antibiotics if we need them. Sometimes we even have to go in for plasma if these horses are super hypoproteinemic and, you know, trying to, you know, improve that and get rid of some of that edema. Polymyxin B is something that we didn't even talk about, but that's something to kind of bind to endotoxins and, you know, could just kind of help improve some of these guys with all that inflammation. But, you know, there's so many things in here that we can do, and it can go from, you know, bad to worse so quickly. So, you know, knowing your horse, watching them, and just being in contact with your vet is going to be probably the most important.
I'd agree. You know, I'd probably say my biggest thing is, like, if you notice these loose stools, if you notice diarrhea, pick up the phone, call your vet. Because this could be something mild or it could be something major, and diarrhea is life-threatening.
It can be, yes.
I can't say that enough. Diarrhea can be life-threatening, and even in cases that we could have fixed, but we got to them too late. Like, there's a point of no return in here.
Right.
So let's just don't get past that.
No.
So, Well, thank y'all for tuning in. Dr. Brown, thanks for being here today. For those of you watching on YouTube, let us know. Do you like these chairs? Do you like the Dr. Phil approach, or do you want you want us to go back to our old way? So, like I said, we tried something new today. Y'all let us know what you think. But keep sending in topics. We really appreciate it. Like I said, we're trying to get to all these, but like I said, we do have real jobs, so can't podcast all day. But thanks again for April for making all this happen. Casey, thanks for editing. Thanks for the whole staff here at Countryside Equine for making this a fantastic place to be a vet. So
Yeah, it's the only place I'd ever want to treat diarrhea.
it's the only place. So all right, thanks for tuning in. We'll talk to y'all later.
Bye.
Thanks. Bye.